Greetings from Human Biological Institute. Welcome to yet another engaging session of our scientific forum, Immunize Talks. At Human Biological Institute, we take immense pride in driving several public health awareness initiatives through our one-of-its-kind platform, Immunize with Pride. Immunize with Pride is an awareness initiative dedicated to educating the public about vaccine preventable diseases and the importance of timely vaccination. These sessions feature leading experts from across the country who share their valuable insights on key health topics, aim to raise awareness, and promote overall well being of the society at large. Today, we are delighted to have Dr. Akash Rai with us to share his expert perspective on hepatitis A, the hidden liver threat. I shall be sharing more about our today's speaker in a short while, and we'll also enter into a very interesting discussion with the speaker. For the moment, please allow me to share a brief introduction of Human Biological Institute. Human Biological Institute is a division of Indian Immunologicals Limited, a One Health company. IL was established by the National Dairy Development Board (NDDB) in the year 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. HBI was established in the year 1998 when the Government of India requested IL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HBI was established at Ooty. The facility is one of its kind in India to have rolled out first modern tissue culture cell culture rabies vaccine in the year 2000. Subsequently, HBI launched other vaccines, and currently HBI is a leader in anti-rabies vaccine segment and is present in around 60 countries. With the vision of shaping global healthcare by spearheading One Health initiative with a mission to innovate, produce, and market quality healthcare products and services to improve and extend lives, HBI believe in providing affordable products with high quality through continuous technical innovations and improvements to meet customer needs. IL is known for its corporate social responsibility. IL has adopted two government schools in the vicinity of Kargapatla, which is near to Hyderabad, Telangana. IL provides infrastructure and basic facility, including the midday meal program. In coordination with National Dairy Development Board, IL is running a gift milk program where over 2,500 school-going children from Telangana and Tamil Nadu are being benefited. IL also donated oxygen generation plant to TIMS at Gachibowli, Hyderabad. To know more about Human Biological Institute or Indian Immunologicals Limited, visit the website www.indimmune.com or follow us in the social media channels. Today, we have our expert, Dr. Akash Rai, and it is my privilege. It is my privilege to introduce Dr. Akash Rai today. Dr. Akash Rai, yes. So we are pleased to welcome Dr. Akash Rai, a distinguished pediatrician and allergy and asthma specialist, currently practicing at Ashtavinayak Hospital and Dr. Akash Rai's Children's Clinic at Raipur. Dr. Akash Rai holds a MD in Pediatrics and advanced fellowships during DPAA from Sir Gangaram Hospital and Colorado, USA, ENS from Munich, Germany, and PGVP from Philadelphia. A passionate pediatric vaccinologist and allergist, Dr. Akash Rai has published multiple research papers in national and international journals. Welcome, Dr. Akash Rai. It's our pleasure to have you with us.
Thank
Welcome,
you
Dr.
so
Akash
much.
Rai.
Yeah, thank you for the warm welcome.
Doctors, today, as you know, the topic is quite interesting. We'll be discussing on a hidden liver threat, a silent liver threat, and which is hepatitis A. There are many hepatitis, and India is really struggling with hepatitis, and one such hepatitis which is hidden, that is hepatitis A. So, Hepatitis A often goes unnoticed until symptoms become severe, and mostly it is said that many people don't even show symptom and they suffer from it.
Yeah.
So, doctor, what is hepatitis A and why it is often called as a hidden liver threat?
Hepatitis, it means this is the infection of the liver, and there is so much of causes of hepatitis. But now we are discussing about the hepatitis A, which is the most common type of hepatitis worldwide.
Okay.
And why it is termed as a hidden liver threat? Because the hepatitis A, most of the time, it is subclinical. There is no symptom at all in initial stage, and the peoples who are infected can spread the infection to the another one during the asymptomatic period. So this is contagious. Even the person who don't know about the disease, he can spread a disease to the community, and most of the time it is subclinical. But in some cases, some associated with some comorbid, some special population, this infection can lead to a very severe mortality, very severe fulminant hepatitis, even can cause the death also. So the detection is very difficult. The symptoms are not very specific. This is overlapping with the another cause of viral infection, I would say. So the symptom is not very specific. Most of the time, even the peoples are not icteric. There is no icterus. There is no yellowish discoloration, and it can cause the hepatitis. It can lead to the further course of the disease. So this is very hidden liver trait because the detection is difficult in initial stage. This is contagious. The patient can spread the infection during the asymptomatic period. So it should get timely diagnosed, properly treated, and best the properly prevented by the different measurement.
So, doctor, many people mistake hepatitis A for a minor stomach infection, and if you see, as you said, it is not many. They may not show the symptoms, and people may not be aware of it. So, how do you diagnose this hepatitis A?
I just want to highlight or give a brief about the endemicity of hepatitis A. The previously, like in our country, India, it was before it was a high endemicity of hepatitis A. It means there the cases are very high on the community. So most of the children before going into the 5 years, they are mostly getting infected by hepatitis. Most of the time subclinical or asymptomatic. So in adulthood, most of the even 90% of the people population was naturally immune by the time. So the disease was less severe on that time. But now the hygiene is improved in India. The class are going into the urbanization. The endemicity is low. So the childhood, most of the population are left. They are not getting infected. They turns into the adulthood, and this disease is more dangerous in adulthood and geriatrics population. So that endemicity has been shifted towards the another one in India. So it is termed as a mild gut flu. It is very wrong because so most of the cases it goes into the very asymptomatic and undetected. Some cases can lead to very severe form of hepatitis, fulminant hepatitis, and can cause the death also. So it's not a normal gut flu. It's a big disease. It involves the liver, and in some particular population, in some children, it can goes into the very severe form of the disease. It should get detected properly and treated properly.
Yeah. So, how do you detect, doctor? Is there any test for it for hepatitis, or you have suppose before going for the doctors? What are the major common classical symptoms of hepatitis A you see in the child?
The myth is when there is hepatitis, there is icterus, there is jaundice.
अच्छा
But
जॉन्डिस होता है सर ये
yeah,
इटरस क्या है सर एक्चुअली
icterus is just jaundice. The medical terminology of jaundice is icterus.
ओके
Yeah, this is same as a jaundice. So we will now term as a jaundice. So jaundice hepatitis में होता है ऐसा हमारा myth है. But in case of hepatitis A, mostly in children population, like we say, if it is less than 2 years of age, 85% of the peoples are not getting icterus, not getting jaundice.
जॉन्डिस ग्रेट
60 to 80% of the children before 5 year of age not getting jaundice. So jaundice was not a classic symptom of hepatitis C. It is very much overlapping with the another viral infection, like a normal stomach pain, malaise, fever, weakness, all this thing. So the detection, for the detection, the doctor should be very watchful for the symptom. And if there is any if there is any doubt of hepatitis, the test should be performed, which is known as a anti-HIV antibody test, which is a IgM, immunoglobulin M and immunoglobulin G. For the recent and new infection, immunoglobulin M should be done within 1 or 2 days. You can get the results, and if it is positive, it confirmed this is a recent infection with the hepatitis A. So this is confirmatory test of hepatitis.
Okay.
But the classic symptoms are not there.
सो हम लोगों को अगर देखना है कोई बच्चों में, तो हम लोगों को अगर जॉन्डिस मिलता है, सपोज जॉन्डिस दिखता है, येलोइंग ऑफ स्किन है, जनरल येलोइंग ऑफ स्किन और जॉन्डिस होता है, तो हम लोग जो भी बच्चों में होता है, तो पेरेंट शुड विजिट ए डॉक्टर, फर्स्ट ऑफ ऑल डॉक्टर को दिखाना है। देन वो जॉन्डिस हेपेटाइटिस ए है नहीं या नहीं, उसको डायग्नोसिस करना है।
Yeah,
उसके लिए टेस्ट चाहिए, टेस्ट
yeah,
रिपोर्ट,
yeah, yeah,
हेपेटाइटिस
yeah. Lab test
टेस्ट
reports.
होता है, लैब टेस्ट होता है।
Yeah.
ठीक है, ठीक है। सो डॉक्टर, एवरीडे एक्टिविटीज लाइक ईटिंग, ड्रिंकिंग एंड इवन प्लेइंग कैन अनोइंगली स्प्रेड द वायरस। Does hepatitis A virus spread in daily life, especially among children and a family? Can it spread like that? Suppose anybody in the family has got a hepatitis A, बच्चे को अगर हुआ है, so उसको क्या chances है कि वो घर में किसी भी दूसरे व्यक्ति को भी फैल सकता है?
Actually, hepatitis A is spread through a direct contact, person to person, but through the fecal-oral route, not from the aerosols or anything else. And there should be a very close contact. It means the families have a high risk if there is any infected persons in the families are there. सो पर्सन टू पर्सन, मतलब जिस बच्चे को इन्फेक्शन हुआ है, अगर उसकी प्रॉपर सैनिटरी हाइजीन नहीं हो रही है, लाइक नैपकिन चेंजेस, प्रॉपर सैनिटेशन नहीं हो रहा है, तो अनदर पीपल्स इन द फैमिली कैन ऑल्सो गेट इन्फेक्टेड। और अगर सपोज माँ इन्फेक्टेड हो रही है, वो फिर कुक कर रही है टू कुक फॉर एवरीवन, so by the food, even with the cooked food, hepatitis A can be spread to another family members.
कुक
So
फूड से भी होता है सर?
yeah, yeah. If the temperature is not that enough to kill the virus,
The
it
virus.
can be spread to the cooked food also.
तो
So
हेपेटाइटिस
the
ए सरफेस में भी रहता है सर? इट कैन सर्वाइव इन द सरफेस, क्योंकि
in some, yeah, in sometime,
यस,
not for the long time, because it's RNA virus. So the hygiene is very important there. If there is any किसी बच्चे को या किसी पेशेंट को, किसी पर्सन को हेपेटाइटिस ए और उसको नहीं पता है, डायग्नोज नहीं हुआ है, he can spread to the all family members to hepatitis A. The proper hygiene should be very important.
सो उस केस में डू यू रिकमेंड वैक्सीनेशन टू द फैमिली मेंबर्स डॉक्टर? अगर वैक्सीनेशन
Yeah,
लेते हैं
if
तो
if
कम्युनिकेबल है?
if the like the sick person has been diagnosed hepatitis A, and all family members had been close contact in the last few days, so recommendation is that within 2 weeks of exposure with the
यस,
confirmed case, vaccination is very effective. They should get vaccinated. They can prevent the further disease and get a natural immunity also. So within 2 weeks of exposure, vaccination should be done. It is well recommended.
yes.
Yeah.
Thank you. So, Rahmat, we can understand that yes, if anybody is infected at home, the family members can also take vaccine for this.
Vaccinate, yeah,
Now,
बिल्कुल.
डॉक्टर, ये ऑकरेंस जो हेपेटाइटिस ए का है, इसका कोई सीजनलिटी है या पूरा साल भर हमको हेपेटाइटिस ए मिलता है? लाइक यू कैन सी उसका कोई लिंक है किसी किसी, बिकॉज इट इज, आप जो बोल रहे थे कि इट इज ऑन सैनिटेशन के ऊपर, कंटामिनेशन ऑफ फूड एंड वाटर, तो ये कुछ कोई सीजनलिटी है या इसका कहीं पे भी किसी टाइम में भी हो सकता है पेशेंट को?
एक्चुअली फीको ओरल रूट से ही फैलता है. लाइक फीकल मटेरियल, जो स्टूल है, जो पेशेंट का स्टूल है, वो शेड ऑफ करता है हेपेटाइटिस से, एंड दैट वाज द सोर्स. अब वो पानी में जाएगा तो पानी इन्फेक्टेड होगा, तो वो कॉमन सोर्स इन्फेक्शन होगा. उससे जो डायरेक्ट कांटेक्ट में जो पर्सन है उनको इन्फेक्टेड होगा. सो सीजनैलिटी इन वेदर, लाइक रेनी वेदर, लाइक रेनी सीजन, मानसून सीजन, not in all cases, because like social, there is so much of way to spread an infection in such places where the sewerage system is not good, when there is the water quality is not good, like drinking water quality is not good, so that resources of water can also be infected with hepatitis A, and this can lead to the outbreak of cases. But like families or direct case to case, it doesn't depends on weather, it doesn't depends on particular season. Yeah, it can
सो
spread.
अगर आउटब्रेक अगर बल्क वगैरह में है, लाइक अब जैसे देखते हैं कि इन ड्यूरिंग रेनी सीजन, इट आपने
Yeah,
बताया था, ये
there's
टोल्ड अबाउट
so
ऑलरेडी।
slightly more cases. Yeah.
हाँ,
Yeah,
रेनी सीजन में ज्यादा होता है क्योंकि वाटर और स्वेज का लिंक हो जाता है,
yeah,
सो
some
बिकॉज ऑफ
cases.
दैट सम केसेस वी गेट। Fine, that's well understood. And doctor, one more question is regarding suppose hepatitis A spread होता है हमारे community में. Somebody find out that इसके family member में है hepatitis A बच्चे को हुआ. What precautions should the members take और उसके neighbor को
Yeah,
क्या members would you suggest?
या जैसे ही डायग्नोस्ड होता है कि इस पेशेंट को हेपेटाइटिस ए है families में, the only method is the good hygiene, the good sanitation. The good hygiene means the first of all the hand hygiene is very important. The person who is caring about that patient, he should wash the hand every time when he touch the patient. First of all, better to isolate if it is possible, but the hand hygiene and poor sanitation, good sanitation, like the patient care should be very good. The common linen, common bed sheets, common towel should not be shared with any another family members. The person who is caring the patient should not cook the food for everyone. uh, just this is normal things. The good hygiene can stop the disease. This is doesn't spread by the aerosols or by the very, it's not very infective. The direct touch should be touch should be stopped, and this should be done.
So simple hygiene means basic the hand
Simple
wash,
hygiene, yeah, hand wash,
maintaining clean drinking water,
clean, yeah,
food here.
yeah.
Right. While doctor hygiene is crucial, it may not be enough for the lifelong protection. So, can good hygiene alone protect against hepatitis A, or is there any other cost-effective tool which can protect us and the community?
No, only good hygiene cannot protect actually, because the some cases are occur when there is outbreak in USA from the common food from the restaurants. It's a cooked food, good
Yeah.
quality food. The cook who is preparing the food is impacted with hepatitis A, and he shed up the viruses to the food, cooked food. So you can get the infection from there also with good hand sanitization also. So the good hand hygiene, the good sanitation, the good hygiene is good thing, but this is not the only tool who can protect the hepatitis A. And the very cost effective and very safe, it is very safe and cost effective. This is the vaccination, and it is well recommended by the government, any all CDC and WHO, that hepatitis vaccine should be taken because it is very safe and effective. It is very effective also. So this
Yes,
is a good
I
tool.
think this is one of the vaccine which is available with us, which gives long-term protection again,
Yeah, very long time.
very long-term protection. So, then, as you said, uh, I mean, vaccination becomes a very cost-effective tool.
Yeah.
So you also said that it is very safety. Is it safe for all age groups? Like, what is the vaccination doses, basically for the children and the adolescent or the adult?
Yeah. Actually, the vaccine is as a primary immunization. The vaccine is recommended between the 1 or 2 years of age, like 13 to 24 years of age, months of age. And is this time the all children should be vaccinated with 2 doses. 2 doses लेनी है 6 months के gap में. 13 महीने से start करके 24 month तक जाएगा. So in this year, if the child is getting vaccinated, this is very good. It will last for the long term immunity. At least for 25 years, it has a very high antibody titers. अगर कोई बच्चा छूट जाता है, 2 साल के अंदर वैक्सीनेशन नहीं हुआ है, तो 2 to 18 years of age, including adolescents, they should get vaccinated with the same schedule, 6 months apart. Adult vaccination and geriatric vaccination, there is so much of different recommendation actually. There is some risk group, not for the all. It is written as a not for the all. There is some risk group who should get vaccinated, like any adult who is already suffering from any another liver disease, any chronic hepatitis B, liver cancer. So they should definitely get the vaccines. Any adults, any healthcare professional who are caring about the patient, child care center, daycare center, sewage worker, plumber, which are more risk to that contaminated water, they should get vaccinated. So this vaccination is safe for everyone, every age group. Well recommended between 12 months to 24 months of age. It can be given as a catch-up vaccination till 18 years of age. And for the adult and geriatrics, there is some risk group has been decided at, and they should get vaccinated.
Yeah. So risk group are basically said the travelers, as you said, then
Yeah,
you have discussed something about the food handlers or the spread of hepatitis A vaccine. I mean the disease of spread of hepatitis A virus at other countries through the food handlers. But in India also, if you see Kerala, we have got several outbreaks which
yeah,
is related to the food handlers,
yeah.
and there is exclusively guidelines for the from the Food and Safety Act, that is FSSI has
Mm.
given a guideline that all the food handlers should be vaccinated with maybe the enteric diseases. So typhoid,
Yeah,
hepatitis A
typhoid hepatitis
again
A.
comes into this thing. So
Yes.
that is quite a thing. And people like who are immuno compromised,
Yeah,
maybe
yeah, yeah.
people who diabetic, as you said, and also people who are suffering from hepatitis B and C and chronic liver disease.
Any chronic liver disease.
Yeah.
Yes.
So does this big disease become severe as the age progresses, or it
Yes.
is, or it is like severity is more in children? What is the severity or morbidity of this
Like,
disease with age?
yeah, like I said before, that below 5 years of age, 60% cases are unactric and very mild. Just opposite, more than 40 years of age, like 40 years से ऊपर, 90% cases are symptomatic. They have a more symptom, and there's a more chances the disease will go into the fulminant hepatitis. However, it is less as a accumulative case of all type of hepatitis, but the morbidity and mortality is high in adults, especially geriatrics, more than 40 years of age. So बच्चों से ज़्यादा adults को खतरा है इस हेपेटाइटिस ए से. जैसे जैसे एज बढ़ते जाएगी, उनके चांसेस ऑफ
Severe,
गेटिंग अ सीवियर
getting
या
severe.
सीवियर होता चला जाएगा.
Right. Doctor, you have already said that the vaccine is safe and long term. It can be used as long term. So, how it is included in the vaccine scheme? It can be given with any other vaccine.
Yeah, vaccination is safe. It can be given with the another like normal vaccination schedule. It can be associated. It can be given at the same time.
So,
Just
seriously.
yeah.
So we see that said many parents, or in India they say that hepatitis A is mild and we should not we can escape this vaccine. It may not be required. So what is your take on it? On it?
Actually, disease mild है बच्चों में. It is true. मोस्टली सब क्लिनिकल
Severity
है.
wise.
पता भी नहीं चलता हमको. होता भी है तो वो ठीक हो जाता है विदाउट एनी स्पेसिफिक ट्रीटमेंट. बहुत कम केस में बच्चों में कोई प्रॉब्लम क्रिएट करता है ये. हॉस्पिटलाइजेशन रेट इज ऑल्सो वेरी लेस. Mortality is very less. It is less than 0.5%. It is true. But without vaccines and without getting a natural immunity, you're going into the adulthood or late adulthood and geriatric age group.
Very
You
risky.
are getting of this infection chances is very high. And then वो नॉर्मल सा बीमारी जो पहले आसानी से ठीक हो सकता था, now it is very severe
Severe.
and
We
it
are
can
seeing
lead to
people who are hospitalized for 10, 15 to
yeah,
20 days.
yeah,
And
work loss is also there.
we have seen people also dying of hepatitis A
Yeah.
in certain parts of Delhi. We have seen the
Mm.
report last year. We have seen in Kerala where
Yeah.
15 deaths. Now, children in Andhra Pradesh, 2 months before, there was an outbreak in a school, and we are very. It's a very sad thing where I think few children died because of hepatitis A. So we don't know when the disease is
Yeah.
going to be
Yeah.
serious and how the virus is going to
Yeah.
behave with.
In
Basically,
2016, the WHO has published one data. 7,600 people died from hepatitis A, accumulative. This
yes.
number is high actually. It
Right.
can be easily prevented with the very safe vaccines.
Same vaccine.
So
Right.
why this number?
Fine. So then, doctor, as we know, we are creating awareness for preventive habits. So, what message you'd like to give it to our families and communities for making hepatitis A prevention a priority? As we wrap up the session, we'd like to have your message for the parents.
हेपेटाइटिस ए वायरस. हेपेटाइटिस ए बहुत कॉमन नहीं है बट बच्चों में ये इन्फेक्शन होता है. डिटेक्शन थोड़ा डिफिकल्ट है बिकॉज सिम्टम बहुत स्पेसिफिक नहीं है. इट्स ओवरलैपिंग सिम्टम. बहुत सारे टाइम ये इनिशियल स्टेज में मिस हो जाता है. इनिशियल स्टेज में मिस होने का मतलब है हम दूसरे बच्चों को प्रिवेंट नहीं कर सकते बिकॉज इन असिम्टोमेटिक दे कैन स्प्रेड टू द एनीवन. सो इनिशियल 2 to 3 वीक्स अगर मिस होता है, अगर हम डिटेक्ट नहीं कर पाते हैं, तो ये हेपेटाइटिस से एक बड़ा गंभीर रूप ले सकता है. इवन लीवर फेल्यूर एंड डेथ ऑल्सो. सो एक छोटी सी बीमारी बड़ी रूप ले सकती है. इसके जो वे ऑफ ट्रांसमिशन है, ये कैसे फैलता है, दिस इज फ्रॉम द फूड फीको ओरल रूट. लाइक Food can spread the disease, water can spread the disease. Any children who is going into the school, the water can be contaminated. He is eating outside, the food can be contaminated. That food handler can spread the disease. So chances of getting infection in day to day life is also high, because in some cases there need to be outbreak aerosols, you can prevent it. But by the food, by the water, the people's, mostly children, can easily get infected. So the chances of infection is high. The spread is very easy. The direct contact spread is also there. Symptom is very non-specific. Detection is also late. So by this is a very hidden liver trait. Even the primary doctor cannot also detect an initial stage. पर्सन को भी, पेरेंट्स को भी पता नहीं चलेगा कब मिलना है. जो जॉन्डिस है, जो पीलापन है, वो सब डिटेक्ट कर पाते हैं, बट बच्चों में ये सिम्टम भी कम है. 60% में दिखता भी नहीं है. सो ये भी, ये मिस हो सकता है. सडनली जो बच्चा है वो बीमार पड़ के बहुत सीवियर फॉर्म में भी जा सकता है. सो एक ऐसी बीमारी जिसको पकड़ने में देरी हो रही है, जिसको डिटेक्शन थोड़ा डिफिकल्ट हो रहा है, जिसके सिम्टम बहुत स्पेसिफिक नहीं है, ऐसी बीमारी को अगर किसी मेथड से अगर बचाया जा सके. सो दो मेथड्स डिस्कस किया हमने. एक, अ गुड हाइजीन, a good sanitization, a good safe drinking water habits, and then second one is the vaccines. Vaccine is very, not very costly vaccine. It's very nominal prices. Is easily available all over the world, and it is very safe. I am not seeing any in my practice any side effect associated with hepatitis A. It can be given with the any another vaccines also. So vaccination दें, टाइमली दें, और अपने बच्चे को हेपेटाइटिस ए से प्रोटेक्ट करें. अगर किसी कारण से उस टाइम पे वैक्सीन नहीं भी लग पाया है, वी कैन गिव अ कैचअप वैक्सीनेशन. सेम
Yes.
शेड्यूल में हम कैचअप वैक्सीनेशन कर सकते हैं. जो बच्चे बड़े हो गए हैं, 12 साल से ऊपर हैं, वो अब बाहर पढ़ने जा रहे हैं, वो बोर्डिंग स्कूल में हैं, वो कोचिंग करने जा रहे हैं, द चांसेस ऑफ गेटिंग हेपेटाइटिस ए इज ऑल्सो वेरी हाई, because now outside food, common drinking water contamination can also be there in major cities. So उस एज में भी बच्चे को वैक्सीनेट किया जा सकता है. आप उनको बाहर जाने से पहले आप वैक्सीनेट करें, हेपेटाइटिस ए के वैक्सीनेशन दें. और इन एडल्ट वन, when there is a comorbid and particular risk group, so vaccination is very easy tool to prevent this type of disease, which is very nominal charge, very it's not very costly, it's very cost effective measurement actually. So my message to the all, if the vaccine is available, by so much of R&D, so much of research, if the vaccine is available, so much of year has been passed, the doctors are using these vaccines. There's no severe adverse effect has been noted. So it is very safe also. So safe, easily available. So I think the all parents should get vaccinated to their child and prevent this hidden disease, which can impact any child like that. And this is my take.
Thank you. Thank you, Doctor. So, while concluding the program, thank you all for being a part of Immunize Talk. We hope today's session was informative and valuable in spreading awareness on hepatitis A, the hidden liver threat. Our special thanks to Dr. Akash Rai from Raipur for sharing his time, expertise, and insights with us today. For those who would like to revisit the program, the video is available on our official social media platform. Please follow us in the social media channel, whether it's LinkedIn, Facebook, Instagram, YouTube. Subscribe to our YouTube channel. Do like, share, and spread the word, as many, including friends, relatives, and uh, your colleagues. Until we meet in our next live talk, stay healthy, stay aware, and please take good care of yourself. Thank you.
Thank you.
Thank you.
Thank you so much.
Thank you.